So I work in economic development. I'm about trying to transform places, transform the future economy, make places competitive. So a little bit of story about local enterprise partnerships. So what happened in the world of economic development, when the government came in, the coalition government, they said, we're going to support the creation of local enterprise partnerships. Joint local authority business bodies brought forward by local authorities themselves to promote local economic development and replace RDAs. So what was happening, they had regional development agencies in the past. There were the sort of similar footprint, I think, to the NHS. Current government thought these were too distant, too large scale, too far away from communities, far away from economic activities. So they moved from the 9 RDA levels in England, and things were different, of course, in Scotland and Wales and Northern Ireland, to 39 LEPs have emerged through. So there was no sunset review in economic development. I was working in an RDA, and a couple of months later I was made redundant. RDA closed down, LEPs came forward straight away. So it was significant transformative change. I think the philosophy at the time was around creative chaos. Get things out of the way, take money out of the system, creativity will come through. So 39 LEPs have come through in that agenda. In the city region, I work for this geography, 6 local authorities, Sefton, Liverpool, Wirral, Knowsley, St Helens and Halton, 1.6 million people, 20 billion economy. Obviously, real significant challenge, opportunities in terms of driving forward the economy, and what we want to see is Liverpool and the wider city region globally competitive and punching its weight both nationally, regionally and internationally as well. So what do we do? I work for sort of a LEP which is a slightly different LEP to the other 39 LEPs. Most of them, I think, are with a secretariat based within the local authority, so very local authority-led agendas. Ours is a slightly different model, a membership model. We've got 450 members that pay into it, including 3 NHS trusts. Got a private sector-led board, which is chaired by Robert Huff from Peel. All the local authority leaders sitting around the table as well. And it's the main body that represents ourselves with government at that city regional level. Underneath it, we've got an innovation board. That's chaired by Sir Howard Newby from the University of Liverpool. We've got a variety of other boards as well, like advanced manufacturing and other sectors as well. And we've got an executive team based at Prince's Parade. So a variety of different members that pay into the LEP alongside other partners as well. So LEP, what are we trying to do? I suppose very much a collaborative model, not a government agency, so we're not a statutory agency, endorsed but recognised by government, giving ourselves greater access to government, right at the very heart of the devolution debate that's going on at the moment about devolution to cities and city regions. We're very much about trying to set a strategic environment for investment. Investment from the public sector, so making sure that government funds that come in here are aligned very much into local economy, but just as importantly, private sector investment. How can we get private sector investment into the city region? So all those UK schemes like Regional Growth Fund, Grow Places Fund, European Regional Development Fund, ESF, all these things, our job is to try and take those all and create a framework for investment. They don't come into our organisation. We're not a big fat organisation that has pots of money. We just put the direct where the funding should go. Have a real focus on key growth sectors. So big challenge for Liverpool City region is we have about 90,000 people less in work than we should do to be at the national average, about 17,000 less companies than we should have to be at the national average. So we need to do something different to be competitive and to change that trajectory of travel. If we just continue on the same trajectory, we'll always be lagging behind the rest of the countries. We need to make a step change, and that's where we feel growth sectors are very important, where we feel key areas that we can make a step change will happen, get competitive advantage. So we're not government funded, very much about a public-private partnership. So I talked about sort of strategic objectives, very much around accelerate that growth of jobs and businesses as well. So why are we working with? So why are we working with the NHS? Well, obviously, this sector, the life sciences sector as I call it, but also the health and well-being sector, is vitally important to the city region economy. We've got about 92 life sciences companies, significant products and services in excess of 1.7 billion. Some of those are real big household names: Novartis, Eli Lilly, AstraZeneca, etc., Bristol Myers Squibb. So a very strong pharmaceutical biomanufacturing focus, but also a lot of smaller, mid-sized companies coming through as well. And one of my visions, I suppose, for this sector is to see some of those 4 or 5 of those smaller companies become global multinationals in the future. We want to create what we call this first-rate innovation system, an innovation ecosystem, a place where it's the easiest place to find the best talent you need, the access to money, the right location, the right networks. So we really want to try and make this place almost sticky for those big companies that are based here. They can't move anywhere else. We want this place to those smaller companies, like we talked about Red Ninja. It's easier for them to access the decision makers and get their products to market very quickly. So we really want to make that interaction between those partners fundamental. If we can do that better here than anywhere else in the country, then we will grow and accelerate our economy quicker. NHS is a key component, part of that ecosystem, as I call it. Challenge for us, I suppose, is to increase the speed of products to market. If we can do that quicker here, then that will bring more companies to this. If we get a track record in doing that, we'll have a real opportunity for clinical trials and drive innovation into provision as well. Talked about the right kind of talent, so having people coming through the system is vital. We've worked very closely with setting up a life sciences UTC. I think it was also around working closely with companies that they have the right talent coming through. Access to finance as well. Have we got the right mix of finance getting into the system so our companies can get the right kind of money going forward? Worked with the Northwest Fund and Spark Impact, particularly on biomedical funds as well. I don't know why my slides are all slightly different as well. We're missing my logos as well, but it doesn't really matter. So the other key issue for me, I suppose, is about that agenda that Andy Burnham was talking about, that future of services. We know that, aging population, changing population, there's going to be a reduction in public sector funding. Central policy, you just heard it both from the Conservatives and also from Labour, that policy push towards integration as well. Policy push about increasing tech into health and social care as well. Big questions about what does the state provide, what does the market provide, and what then does that mean for the city region economy? If we know this is going to change in the future, we know there's going to be systematic and fundamental change of who provides services and how they're provided, what does that mean for the people working in that sector now? That's a big risk for us, but also a significant opportunity. We've got a large public sector, a much larger public sector than we do than other parts of the country do in terms of its numbers. So we have a real opportunity and threat. So knowing this change is coming, can we get ahead of the curve? Can we anticipate it? Can we almost accelerate a growth of what that future economy will look like here, with companies or social enterprises, all the public sector delivering value back to the city region economy, as opposed to waiting for some, Nottingham-based company to deliver those services. So can we look to get ahead of the curve, and similarly then can we export that to really create a hub for that economy based locally? I think one of the key fundamental challenges facing the city region economy over the next 10, 15 years is how we handle that, navigate that agenda, and actually get ahead of the curve. So how are we working then with NHS and partners working with the Academic Health Science Network? Well, we've been working on what we call our innovation plan. So how do we stimulate and drive innovation over the next 5-6 years? It's a relatively short-term delivery focus. The jargon used at European level is very much around smart specialisation. So we're trying to focus on areas where we've got competitive, critical mass and advantage. It's very much a key component into my landscape, what we call these local growth plans, where we do deals with government for access further funding and other investment. and also very much builds on current investment in that we've made in the likes of Alder Hey, the Liverpool Bio-Innovation Hub, which you heard from Ian earlier, and partners at School of Tropical Medicine. So going forward, this is about our framework for how we're going to be spending, those public monies that we will have under our remit, like European regional development funds as well, and also look to try and lever in funds from Europe as well. Health and well-being, right at the very heart of that, we have 4 priorities and one sort of cross-cutting priority around creating this ecosystem. Health and well-being, creative and digital, blue-green innovation, and advanced manufacturing. And we've focused on 12 delivery programs, of which there are 2 emerging through our plan. Precision medicine or stratified medicine, so building on the world-class capability we have in stratified medicine and looking to commercialise that, making Liverpool City Region a place where those products get quicker to market and we develop a critical mass around that. And then looking at the My Liverpool programme and its successor programmes very much around the social health care agenda, the assisted living agenda, and that growing provision of marketplace I talked about earlier. Working very much with local authorities and the NHS on this health and social care economy plan, so really working to try and understand how we can anticipate that future economy, how we can look to develop capacity and capability within organisations and within the third sector and other private sector partners as well, and looking at different work programmes as well on that. And that's quite advanced, I have to say, in the local authority land. I'm finding it harder with the NHS, if I'm being honest. It's trickier. I feel the challenge, that real challenge around provision of services right at the very heart of what local authorities are doing at the moment, it perhaps feels a bit further away from your day-to-day reality. So again, I'm really working with the NHS to try and map out how that will be in the future. Working around inward investment, so what's our story, our narrative, how are we selling this around the world? So companies, partners, research institutions recognise this is a place to do business. This is a place to get things done quicker. Very much working with partners, and particularly the Academic Health Science Network, to develop a promotional campaign, a joint marketing activity, and a soft landing program I think we want to work on, so those companies coming here will get an ease of access and integration into the work, that ecosystem I talked earlier. And then similarly, the other thing is trying to get some kind of joined up approach. So business has a one-stop shop. So all these kind of agencies you've seen here today, LEPs, Academic Health Science Networks, other partners, how can we actually get a joined up single point of contact for businesses so they can get through that maze as quick as possible. So working very closely with partners in the Academic Health Science Network, health partners, strategic clinical networks, and the brand we're developing is this health enterprise hub. It will be jointly owned by ourselves, and again, going on from that brand, we want to develop blended budgets, joint action plans, joint delivery of interface with partners, joint workshops, etc. Great opportunities around that. At the moment, we're currently recruiting for our Health and Wellbeing Life Sciences Manager. That's out for recruitment, and that's a joint post between ourselves and Academic Health Science Networks. That's great. It shows how we can actually work effectively together. The job advert for that closes tomorrow, so if there are any people in the audience who are interested, get your applications in. Similarly, if there are other partners who feel that could be somebody seconded from your organisation in, really interested to look at secondments in as well. So very much about moving towards that budgets and joint action plan. So finally, just some lessons learnt from me in terms of where we are. This environment for joint working is really quite challenging, but it's extremely rewarding. We've got variable geographies. I showed you a map of my 6 local authorities. There's a map there of Academic Health Science Networks. We've got CCGs working at local levels. So trying to navigate that is challenging. It's not easy. We need to better understand our opportunities collectively. Events like this today, I think, are great. we people here in the economic development world, we need to understand your world much better, and vice versa. I think there needs for greater leadership from the health sector in this field, really understanding how we can unlock economic growth, and vice versa. We need to understand how we can actually unlock your systems better as well. Real need for thought leadership, but also quick wins. And I think we need to develop those joint governance models as well. Avoiding duplication of activity is crucial. In my world, we've got hardly any money, so how we spend it, we've got to spend it smartly, wisely, and effectively. So the examples there of joint JDs and joint posts is crucial. Having on that card 2 logos, there's a one-stop shop would be great. And managing our organisational pride and self-interest. We're all a relatively new organisation in this field, so we all want to get onto the podium and say, we're great. But actually, what we really need to do is focus on the end user. You know, in my case, it's about those companies, other organisations, about the people and patients in the system. Very busy and complicated agenda, so I pointed out 4 areas we're working on. So try and develop a manageable amount of activities. Picking the right time to engage with the private sector is vital as well, and invest in developing those relationships. Finally, developing a joint language and branding. The last thing I'd say is that challenging and rewarding environment. I have to say, 1 year on, working with the North West Coast is really rewarding. So congratulations to Gideon, to Bruce, I see in the audience, to Liz and the team. I think we made a really good start. Congratulations 1 year on. We're looking forward to working much more closely with you and your wider partnership. Thanks a lot.